Welcome to the FCC's Connect to Health Task Force webinar on mapping broadband and maternal health. I'm pleased to introduce Michelle Ellison, Chair of the FCC's Connect to Health Task Force. Michelle?
Thank you. And good afternoon, everyone. I'd like to extend a warm welcome to each of you. We are so pleased that you could join us for a live demonstration of the latest release of the Mapping Broadband Health in America platform, a truly groundbreaking effort. Today's webinar is about the fundamental vision of connecting everyone, everywhere, to the people, services, and information they need to get well and stay healthy. While we developed this vision back in 2014, when the task force was first launched, it has stood the test of time. And it couldn't be more apt as we begin today's dialogue on the role of broadband in helping to address the intractable crisis of maternal mortality in the United States. In fact, maternal mortality rates have been increasing over time, and the picture is even worse for women of color. What is particularly striking and poignant is that according to researchers, 80% of these deaths are preventable. So with that, I'd like to take a moment to recognize our sister federal agencies who've joined us today and who daily fight the good fight to improve maternal health in our country. The Centers for Disease Control and Prevention, as well as the Health Resources and Services Administration. We know the FCC is only a piece of this very complex puzzle, but we intend to do more than our share. And a special thanks to the team at MITRE Corporation for helping us to facilitate this webinar. Now today, we are honored to be joined by FCC Chairwoman Jessica Rosenworcel. Our chairwoman began her storied tenure at the commission in 2012 after more than a decade and a half of communications and policy experience in the public and private sectors. In a word, Chairwoman Rosenworcel is a dynamo. She has been a tireless champion for the transformative power of broadband connectivity in education and in health and healthcare, particularly in combating the maternal health crisis facing our nation. Now, she comes from a family of doctors and clinicians, so healthcare is in her genes. Her father was a nephrologist in Connecticut, where he ran the local clinic for hypertension and kidney failure. And in an interesting twist of fate, the chairwoman's father-in-law, brother-in-law, and sister-in-law are all physicians. So as the first woman in over 89 years, and can you imagine that? But the first woman in over 89 years confirmed to lead the agency and a mother of two, Chairwoman Rosenworcel brings a unique and critical perspective coupled with the vision, passion to make a real difference. No one has come to the job better prepared or with greater determination. And for that, she has become our shero. We remain grateful for the opportunity to work under her leadership and for her unflagging support of the task force's work. So Chairwoman, we are so pleased that you will set the tone for today's presentation. And with that, my friend, the platform is yours.
All right. Well, Michelle, those words are unreasonably kind, but to everyone here, I really, really wanted to join you today. For some of the reasons Michelle mentioned, I'm the first woman to permanently lead the Federal Communications Commission. I'm also the first mother. When I joined this agency, my kids were little and they are now teenagers. That is how time goes. But, you know, there's things in parenthood you don't forget. The day you first became responsible for a young child. It is overwhelming in every way. And I think being a mom and having had that experience makes you keenly aware of the experience of others who become mothers. And it makes you laser-like aware of some hard truths, which is that we have a maternal health care crisis in this country. We are the only industrialized nation with a rising level of maternal mortality. That hits women of color particularly hard, and it hits women who live in rural areas particularly hard because we're seeing the closure of so many hospitals and obstetric facilities. So I just think in the United States in the 21st century, surrounded by all this technology, including the technology we're using here, that shouldn't be the case. This to me is a problem everyone needs to devote their energies to and everyone needs to help solve. Because as Michelle said earlier, most pregnancy-related deaths are preventable. So let's look for every way we can improve healthcare outcomes for those who give birth in this country. And so that brings me to the work of the FCC. I admit we're not the obvious forum for this discussion, but I know from my own travels around this country to healthcare providers in places like Arkansas and Minnesota, that there are solutions like telehealth that can play a major role in preventing maternal deaths and, more importantly, just help people have healthy pregnancies. So this agency has actually done a lot rather quietly over the years. We promoted access to broadband in healthcare settings through our Universal Service Fund. We have a rural healthcare fund. In addition, we had some emergency programs that we ran during the COVID crisis to help assist healthcare facilities around the country with developing telehealth and telemedicine solutions during the height of the crisis. And I think that support has been meaningful. And I know that some of that support has also specifically addressed issues with maternal care. So the other thing that the agency has been doing is we gather a lot of information. We have a lot of data about broadband, where service is and is not in this country. And we've been trying to unlock that data to better understand how connectivity can help with healthcare outcomes and the kind of medicine and telemedicine initiatives that can be supported in different areas in this country. That's why we established the Connect to Health Task Force to develop a tool, which we call the Mapping Broadband Health in America platform, to identify where access to broadband could result in positive changes to health. And Congress took a look at what we were doing. I think we were ahead of the curve. And last year, they passed a law called the Data Mapping to Save Moms' Lives Act, taking note of the maternal health care crisis and the work we had done on this platform. So in June, the FCC took an important step to help address the maternal mortality crisis by updating our Mapping Broadband Health in America platform to include new maternal health data. So that's a start. But we know there's so much more we can do to make sure that this resource is useful for policymakers, healthcare professionals, and groups advocating for better health outcomes for mothers. So that's why today I actually circulated a notice to my colleagues inviting public input on how we can better improve the Connected Health mapping platform and identify links between broadband access and maternal health. It's my hope that 3 weeks from now, we're going to get 3 votes on it from my colleagues, and they are going to support the effort to ask questions about this and seek information. Bottom line is, if there are good ideas out there about how we can adjust this data and adjust this platform, we want to know. And this is an invitation to make sure that you reach out to us and provide us with your best ideas and best thoughts. Now, today, you're going to hear from members of the Commission's Connect to Health Task Force about how to use this platform, because it's not enough for it to just exist. We need the people who have real experience in this area to understand what we've produced. And you will learn how to generate customized maps, visualize the intersection of broadband connectivity and maternal health care data at the county and state level. And then we've got a whole bunch of connectivity metrics that you can filter by rurality, race, ethnicity, maternal age, and even the intersection of broadband and mental health provider shortages. We want to make sure that this information is as useful as possible, so getting familiar with what we've already developed is really the start of that conversation. Again, I'm so grateful that we are here with you today and that we can play a role in solving what is a crisis that I believe deserves a lot more attention in the United States. So our part is now we got a lot of data, and we hope you can help us learn how we can use it effectively, because we got work to do to solve this crisis. And again, I'm grateful for everyone who's here who wants to be a part of that solution. And I'm very grateful for Michelle Ellison, who is the FCC's General Counsel, also the first Black woman to be the General Counsel at the Federal Communications Commission, and also Karen Onije, who is our Deputy General Counsel and the task force's Chief of Staff. They are also dynamos. If we overuse that word today, it's okay, because it's all true. And I'm so grateful everyone is here, and appreciate you spending a little time with us today. So Michelle, take it away.
Thank you so much, Chairwoman. We really appreciate your kind and inspiring words, as well as your leadership. And now I'm going to turn to our talented Chief of Staff and Deputy General Counsel, Karen Onije.
Thank you, Michelle, and good afternoon, everyone. I'm Karen Onije, as Michelle said, and we're delighted that you can join us as we dig deeper into the Mapping Broadband Health in America platform. So as Michelle mentioned, for nearly a decade, the task force, and I just want to remind you of this, has been committed to a simple vision: everyone connected to the people, services, and information they need to get well and stay healthy. And that is the first, right, touchstone that you need as we go through this webinar today. And there's a second. I'd like to share a brief story to further ground our time together. A story that we hope you'll keep in mind throughout the presentation to sort of provide a vision of what is possible. And it comes from a recent report on NPR that captures the possibilities and the power of this vision that you saw in maternal health. And I'm going to need you to go on a bit of a journey with me. Let's travel to Clayton, New Mexico. It's a small town of roughly 3,000 people tucked into the far northeast corner of the state. While the town has a small rural hospital, its obstetrics department has been shuttered for over a decade. And yet pregnant women in Clayton and the surrounding counties don't have to make the 3.5-hour round trip to the closest labor and delivery facility for their many routine prenatal appointments and tests. Rather, through the power of broadband connectivity, pregnant women in Clayton have instant or near instant access to receive critical information from their healthcare providers and care teams. And with connected solutions like remote blood pressure cuffs and fetal heart rate monitors, and many other cutting edge things to come in the future, doctors are able to remotely assess and monitor mother and child and intervene as needed in real time. So Clayton obviously is only one success story like this, but it reminds us of the critical work that lies ahead, the work that Chairwoman Rosenworcel was just talking about. And it reminds us that increasingly broadband equity is health equity. In fact, there's an old saying that pops into my head, that you cannot mend what you cannot measure. And the groundbreaking mapping platform that you're about to see can help us pinpoint the gaps and opportunities at the intersection of broadband and maternal health. And that is exactly what we're going to do today. So let's talk a little bit of road mapping now, so you know what's coming. First, we're going to explain briefly our approach to intersecting broadband and maternal health data. We want to lay that groundwork for the why and how of this platform, this Mapping Broadband Health in America platform. Second, recognizing that a picture is worth 1,000 words, we will then move into the live demonstration portion of the webinar. The live demo will be organized around 4 burning questions, 4 examples, if you will, that we'll ask the platform to help us answer. And then we will make sure to reserve some time for a brief Q&A session. So 2 quick housekeeping notes. We want to invite you to share any questions that you may have. You can share them along the way using the Zoom Q&A feature. It's a button probably at the bottom of your screen. And periodically during the webinar, we'll be pushing information out to you through the chat. So be on the lookout for those. So with that roadmap, let's get going. I am joined by my colleague, Dr. Ariel Mancuso, who is the Director of Research and Analytics for the task force. And we're going to work together to show you this platform and demonstrate its important features. And Ariel, I'm going to ask if you wouldn't mind starting us off by sharing a bit more about the what, the why, and the how of the Mapping Broadband Health in America platform. I think that context would be especially helpful to new users. Thank you.
Yes, of course. And good afternoon, everyone. And thanks, Karen. Starting with the what. What is the Mapping Broadband Health in America platform? Next slide, please. The Mapping Broadband Health in America platform is an interactive tool that enables users to intersect, visualize, and analyze data on broadband and health at the county, state, and national levels. We'll explain what we mean by the word intersect in just a moment. Next slide, please. Before we dive in, I want to take a few minutes to talk about the why. Why broadband and health? Why a mapping platform? Why maternal health? There's increasing recognition that broadband is an essential component for achieving better health and health equity. Now more than ever, patients are receiving much needed care through solutions like telehealth that often rely on broadband or some form of high-speed internet connection. But broadband is more than just the critical infrastructure that connects patients to doctors. Next slide, please. Prior research by the Connect to Health Task Force shows that areas of the country that are more connected to broadband tend to have better health, even after accounting for differences in other characteristics. This suggests that broadband itself may have its own direct influence on health beyond specific telehealth applications. So now, why a mapping platform? The FCC's Connect to Health Task Force launched the Mapping Broadband Health in America platform in 2016 because of an articulated need to easily identify gaps and opportunities in both broadband and health. Other platforms for either broadband or health exist. A tool that explored the intersection, again, of broadband and health and curated the resulting insights did not. To do this, the FCC created a platform that gathers and visualizes data on broadband and health across the US. But the platform does more than just overlay this data. It intersects it. What do I mean by intersect? And this is very important. In short, the platform combines and shows the data in novel ways that produce actionable insight for cross-sector stakeholders, a shared roadmap for action, if you will. So last, of all the health topics we could focus on, why maternal health? As the chairwoman remarked at the beginning of this webinar, the US faces a maternal health crisis with increasing maternal deaths and the highest rates among Black, African American Indian or Alaska Native, and rural women. This crisis has been exacerbated during the recent COVID-19 pandemic, and to make matters worse, most of these deaths can be prevented. Telehealth and other broadband-enabled solutions offer new and exciting potential to help address this crisis. For example, telehealth can be used to ensure that more pregnant women receive adequate prenatal care where access to obstetric services is limited. We had that case at the beginning of the webinar. Pregnant women who have chronic conditions like hypertension or diabetes that put them at increased risk of poor outcomes can be more closely monitored by their healthcare team using remote online systems. And there's much more that broadband can enable for the ecosystem of maternity care with emerging technologies like machine learning and artificial intelligence. However, these solutions rely on a person's ability to access and subscribe to high-speed internet services or broadband. Recognizing the importance of broadband for maternal health, the recent Data Mapping to Save Moms' Lives Act directed the FCC to incorporate data on maternal mortality and severe maternal morbidity into its mapping platform. This directive, along with prior efforts to incorporate data on the opioid crisis, highlights the value of this tool and the opportunity for broadband to help address some of the nation's most pressing health challenges, like maternal health. Finally, the how. Incorporating maternal health data into the mapping platform proved a really complex and rewarding task. We've pursued a multi-phase approach, completing the first phase within 6 months as required by the law, and additional activities planned going forward. To start, we developed an initial conceptual framework on the intersection of broadband and maternal health that you can see here, and I know it's a lot. Our framework includes not just the outcomes specified in the law, which were must-haves, of course, but also the risk factors, access to care, and social determinants of health related to these outcomes. Our relationships between broadband and health, as theorized by the task force. These relationships inform the way the platform is structured and is foundational to our understanding of broadband and health. First, broadband can have a direct influence on health as the critical infrastructure for broadband-enabled solutions or technologies for maternal health. Second, broadband may be a distinct social determinant of health, exerting its own influence on health, with areas that are more connected tending to have better health outcomes. This pattern remained even after controlling for differences in other characteristics, although the mechanism is not yet clearly understood. Third, broadband can be considered a super determinant of health, as it is increasingly important for many other daily activities like work and education. Research shows that women who are more educated are less likely to experience poor maternal health outcomes. In today's world, applying to a higher education program, registering for and participating in classes, and completing course assignments increasingly relies on broadband. This framework was used to select relevant measures for incorporation, with those in pink incorporated during our initial effort. For more details on our approach, please visit the Focus on Maternal Health tab in the platform. We'll be navigating to that page shortly. So I know that people are excited for the live demo, so let's get started. Karen, would you please bring up the mapping platform?
I am working to do that as we speak.
Give us just a moment.
And there you are.
Great. Awesome. All right, let's go. All right, welcome to the newly updated Mapping Broadband Health in America platform. We're currently on the landing page for the platform. As you can see, the platform now incorporates data on maternal health in response to the Data Mapping to Save Moms' Lives Act. There are 2 large buttons, one for maternal health and the other for the chronic disease and opioids data that already existed in the platform. In this demo, we can really only scratch the surface, so we thought we would skip to the back of the book, so to speak, and give you the key point, the key takeaway right up front. Here it is. The updated Mapping Broadband Health in America platform is more than a series of maps. It is a new way of thinking about, a new way of analyzing the intersection of broadband and maternal health, a paradigm shift, if you will. Today, you will see phase 1 of this groundbreaking effort. Phase 2 is currently underway, and there's so much more to come. Now we're going to navigate to the maternal health module of the platform. We do this by clicking on the icon showing a pregnancy in pink. Today's demo will use live navigation to illustrate some of the key components and features of this platform. My colleague Karen will be helping me to navigate the platform while I take you on a sample journey through the intersection of broadband and maternal health. As she mentioned, we'll be focusing on 4 core examples of how you can query the platform and generate customized shareable visualizations. But first, we want to give you a quick orientation to our main page. On the top is the main navigation bar. The background tab provides important background information about the platform. Getting started, gives you an orientation to how you can use the platform to generate custom maps. You can learn more about the maternal health crisis and our approach to intersecting broadband and maternal health data in the Focus on Maternal Health page. And finally, the Data tab explains more about the measures that can be visualized in the map. You can also get back to the map by selecting Maps and then Maternal Health. On the maternal health map, on the left is the control panel, and this panel is especially important. The control panel enables you to customize the intersection of broadband and maternal health. As you can see, this tool is completely interactive. We are going to spend a lot of time in this demonstration showing you how you can use the control panel to create custom maps. To the right is the main mapping area that automatically updates depending on what the user selects in the control panel. Also note the search boxes here where you can search by county or state. You can also switch between levels using the toggle in the map and selecting either county or state. And finally, you can zoom in on a particular area of the country in the map using the buttons. Below the map are the plots and tables that provide additional context about the custom visualization. Here you can see a relative distribution of county categories or information on the number of counties and population in each county category in the table below. Before we go any further, there is one critical piece of information that you need in order to understand how this platform works and how you can leverage its power for your purposes. And here it is. The platform is organized around 3 views that illustrate various ways to intersect broadband and health data. The overview shows areas of the country where broadband and health needs coincide, or areas where broadband and health are a high priority. In this view, you will see counties categorized based on their broadband or health needs. The broadband view shows broadband as a function of maternal health, or the picture of broadband across levels of health need. In this view, what we are visualizing is broadband data filtered by maternal health. The maternal health view shows maternal health as a function of broadband, or the picture of maternal health across levels of broadband. Compared to the prior view, instead here, we are visualizing maternal health data filtered by broadband. Going back to the overview, note that we use connectivity as umbrella terms to reflect different dimensions of a person's connect to high-speed internet, so it can be used for health purposes. The map includes measures related to both access, or the availability of fixed broadband services, and adoption, or the number of households subscribing to internet services, in addition to other measures like speed. More information on each of these measures can be found in the Data tab of the platform. The platform now also incorporates measures related to maternal health to intersect with broadband. These measures reflect the maternal health outcomes specified in the law, select risk factors for poor maternal health outcomes, and information on access to maternity care. Together, the broadband and maternal health measures in the platform provide a range of options to intersect and customize for diverse stakeholders and purposes. Now that you have a bit of orientation to the various components of the platform, let's start creating some maps. We'll start with our first example in the overview. When Congress enacted the Data Mapping to Save Moms' Lives Act, some visionary lawmakers wanted to see a picture of where maternal mortality rates were especially high and identify areas where critical telehealth resources like broadband or telehealth services needed to be deployed. In the overview, you can ask and answer questions like, where are areas of greatest need where critical telehealth resources need to be deployed to help address the maternal health crisis? Recall that in this view, the map, plot, and table display information on where broadband and maternal health needs coincide. This would identify priority areas where broadband, if available, could be leveraged to help address the maternal health crisis. And this will be our first example. To create our first custom map, we start by selecting a broadband variable and maternal health variable to intersect. Here we have selected download speed. It represents the percent of the population with access to fixed broadband services at download speeds of 25 megabits per second or higher as a critical resource for telehealth. We have also selected maternal deaths as the maternal health variable. This variable shows counties that have reported maternal deaths or no maternal deaths. Even one maternal death being reported in a county can be seen as high, since most of these deaths are preventable and most counties have reported no deaths. The corresponding map plot categorize areas into 4 groups: double burden, opportunity, single burden, and milestone. To see definitions of each of these county categories, simply hover over the eye icon next to the plot. Eye icons indicate important information throughout the platform. Quick side note, when you create a particular map, the platform automatically generates a custom link to save or share it. Here we have copied the link to the map and put it in the chat so you can access it. Throughout the demonstration, we will share the links to the different maps we create in the chat. Going back to the map, where we're intersecting download speeds and maternal deaths, double burden areas shown in purple in this map have lower broadband connectivity, in this case download speed, and higher health need. Double burden areas are where there are significant gaps and a need for improvement in both health and broadband connectivity. In other words, where broadband-enabled solutions like telehealth could be a critical part of the toolkit in improving health, but the broadband resources in place may be unequal to meet this need. In the map, health need is defined as a county reporting maternal deaths. And on the broadband side, we're showing areas that have download speeds below the national average. In this case, where less than 66% of the population have access to broadband at download speeds of 25 megabits per second or higher. This median represents the number at which half of counties have better connectivity and half have worse. We can see that many of these double burden counties in purple in the map are concentrated in the South, Midwest, and West. People living in these counties could benefit from efforts to increase broadband availability at adequate speeds that can in turn be leveraged for telehealth to help prevent maternal deaths. Recall that we wanted to identify the areas of greatest need. To do this, we can specify the threshold used to categorize areas by moving the slider bar or typing in the box. When we set the threshold to 50, rather than the national median, the map shows double burden counties in purple that have reported maternal deaths and where about half of the population does not have access to broadband at download speeds of 25 megabits per second or higher. These areas are more burdened and represent those that are facing the greatest need. You can also do this with any other number that you would like, as well as reset to the national median. The plot and table also provide relevant information to help you understand and interpret the map. In the plot, you can see the number of counties that fall into each category. The table also shows the population living in counties in each category. For this map, the table tells us that there are many counties that have reported maternal deaths and that are home to a sizable population, many of which do not have access to higher broadband speeds. This population information is important because it can give you a better sense of the scope. Some counties cover a big area but have a small population, and other counties are small but densely populated. As such, this information is a useful complement to the visualizations to help complete the picture. So recall that in this example, we wanted to identify areas where critical telehealth resources needed to be deployed. We just displayed a map that showed where broadband resources as the critical infrastructure for telehealth could be deployed. Now let's look at counties where, at least according to the data snapshot in the current platform, broadband may be more available and where telehealth services might be able to be deployed now to help address the maternal health crisis. Now we'll keep the health variable constant using maternal deaths and select the internet adoption variable for broadband. This variable represents household subscriptions to the internet. People living in these connected households may be able to use broadband for telehealth services to help prevent maternal deaths. The map shows opportunity areas in blue. These are areas that have higher rather than lower broadband connectivity, along with higher health need. In this map, the opportunity areas in blue are counties that have reported maternal deaths and where more than 70 out of every 100 households have an internet subscription. These represent areas where many households may already be connected and where telehealth services could potentially be used to help prevent maternal deaths. You can see that many of these counties are in the West and in the Northeast. In the current map, you can see all 4 county categories from intersecting internet adoption and maternal deaths. You can also choose to show only counties that are reporting maternal deaths. The map now shows only counties that are double burden or also have lower connectivity in purple, and opportunity or who have higher connectivity in blue. In other words, the map is showing the different connectivity picture in counties that have maternal deaths or higher health need. Next, we move to the broadband view. Remember that in this view, users can explore broadband as a function of maternal health. In this view, the maps, plots, and tables display the picture of broadband across levels of health need. This can be used to generate insights on the status of broadband in areas of higher health need to help inform health interventions that leverage broadband. This view can also be used to enhance our understanding of the relationships between broadband and health by comparing the picture of broadband in areas of higher and lower health need. Let's show you what we mean by our second example. Imagine a local health organization that is working to address maternal health issues in rural areas. They would like to introduce a new mental health program for pregnant women, one that includes telemental health services. To aid in the planning and rollout of the new program, they might be wondering, what is the broadband picture in rural areas that are facing mental health provider shortages? We will explore this question with our second example. To show this, we would first select a broadband variable. For this example, we have selected internet adoption because this is a measure of the number of households that have subscribed to the internet so they can use it for telemental health. The corresponding map, plot, and table display the distribution of the selected broadband variable, in this case, internet adoption, showing areas with lower levels of broadband in yellow and green and higher levels of broadband in dark blue. Lower connectivity in yellow and green, higher connectivity in dark blue. Note that for internet adoption, Red indicates areas where the data has been withheld to maintain firm confidentiality. Users can then filter by a selected maternal health variable to display and compare the picture of broadband in areas of higher or lower health need. In this example, the local health organization is looking to introduce a mental health program interested in where there are mental health provider shortages. So we'll select that. This measure provides information on the degree to which an area is experiencing a shortage of mental health providers. The higher the number, the greater the shortage. We can then use the slider bar or text box to isolate only those areas that are experiencing mental health provider shortages or have a score greater than 0. The corresponding map shows the distribution of internet adoption in areas with mental health provider shortages. We can see that there's a cluster of these lime green and green counties with lower connectivity across the South. We have put the link to this map in the chat. The table then tells us that there are many counties with sizable populations that have mental health provider shortages and lower levels of connectivity in lime green and green. The local health organization in this example might want to consider how best to increase household internet subscribership for women as part of their mental health program, especially in areas that are yellow or lime green, and further consider how to roll out their new program equitably, considering differences in connectivity. Okay, now recall that we mentioned at the beginning of this example that the local health organization was specifically interested in addressing maternal health issues in rural areas. The mapping platform also enables users to filter by rurality, maternal age, race, or ethnicity to isolate areas that have certain characteristics. What do I mean by that? Let me show you. Given that the local health organization is focused on rural areas, they might want to visualize only areas where 50% or more of the population resides in rural areas, or areas that are majority rural. They can do that by using the rurality filter and selecting greater than or equal to 50% rural population. The map now shows the broadband picture in counties that are experiencing mental health provider shortages, but only for those counties that are majority rural. Again, you can see a concentration of counties with lower broadband connectivity in lime green and green in the South. See the chat for a link to this map. The table also tells us that many of the counties that are experiencing lower connectivity along with mental health provider shortages are majority rural. We can tell this because when we apply the rural filter, most of the same counties, about 320 of the 350 we saw before, appear in lime green and green. You can then compare that picture to the one in areas that are mostly urban. When you select the less than 50% rural population, you can see that the connectivity picture changes. There are now very few counties in yellow or green. Almost all counties are blue. Going back to the majority rural, where we're seeing majority rural areas, now let's pretend that the local health organization is based in Louisiana and plans to serve counties in that region. You can also zoom in on a particular region or state of interest using the zoom buttons and dragging the map to position it. Now you can see a closer picture of the status of internet adoption in rural counties experiencing mental health provider shortages in Louisiana and the neighboring areas. To get more information on the counties displayed in the map, simply click on the county and a pop-up with relevant information will appear. You can also search for a particular county and it will highlight and zoom to its location. Let's look, for example, Pushmataha County in Oklahoma. And you can see the map highlights that county in yellow and zooms to its location. Okay, last, let's move on to the maternal health view. In this view, the map, plot, and table allow users to explore maternal health as a function of broadband. It displays the picture of maternal health across levels of broadband. This view can shed light on the health status of those living in areas with lower connectivity and potentially reveal opportunities for innovation and entrepreneurship in those areas. Like the broadband view, this view can also enhance our understanding of the relationships between broadband and health by comparing the picture of health in areas of lower and higher connectivity. And we'll come back to that after this example. In our third example, imagine you're an innovator or entrepreneur in the broadband and health space, interested in cross-sector collaborations. You're interested in exploring the question, where are areas experiencing gaps in maternity care that your innovation or broadband-enabled solution could help to bridge? In this view, users first select a maternal health variable of interest to intersect. For this example, we have selected the measure for maternity care deserts. This measure reflects the level of access to obstetric care in a county, with counties that have lower levels of care being areas where telehealth services and innovative broadband-enabled solutions could help to fill the gaps. The corresponding map, plot, and table display the distribution of the selected maternal health variable, again, maternity care deserts, showing areas with higher levels of maternal health need in darker pink. In this map, maternity care deserts in the darkest pink are counties that have no hospitals, birth centers, or health providers offering obstetric care. Counties in medium pink have low or moderate access to obstetric care, and counties in light pink have full access to maternity care. Users can then filter by a selected broadband variable to display and compare the picture of maternal health in areas of lower or higher connectivity. In this example, the entrepreneur might want to explore the access picture by selecting broadband access, adoption picture with internet adoption, the speed picture by selecting either download or upload speed, or even zero in on access in rural areas with the rural access measure. In all of these examples, you can see that there are many clusters of purple and dark pink counties that have limited access to obstetric care and where broadband-enabled solutions could make a difference. Switching gears for a moment, I mentioned previously that both the broadband and maternal health views can be used to enhance our understanding of the relationships between broadband and health. So refreshing on this page, so I want to finish with our final example. For the more research and analytical folks on the line, I want to take a few minutes to show you what I mean by looking at the relationship between broadband and health. So going back to the maternal health view and selecting maternity care deserts and broadband access, we'll compare the picture of maternal health in areas of higher and lower connectivity. This can shed light on the potential relationship between broadband and health by answering questions like, do areas that are more connected tend to have better health? Or alternatively, do areas that are more digitally isolated tend to have worse health? We'll create a map where fewer than 60% of the population have access to broadband as the picture of lower connectivity. Here we can see that most counties are designated as maternity care deserts in dark pink. There are only some with full access to maternity care in light pink. And you can see this also in the plots and in the table. See all the maternity care deserts and very few with full access in light pink. We can then compare that picture of maternity care access in areas with lower connectivity to that in areas with higher connectivity. Let's now isolate the areas where more than 80% of the population have access to broadband. We can see that the maternal health picture here changes and almost seems to reverse. Now, almost all counties have full access to maternity care in light pink, and only a few are designated as maternity care deserts in dark pink. So you see a complete reversal of the plot that we saw previously. This can shed light on the potential relationship between broadband and health, suggesting that areas that are more connected tend to have better access to maternity care, or areas that are more digitally isolated tend to have worse access to maternity care. I want to end with one important question that we often get. Why is the mapping platform showing a map where almost all counties are visualized in shades of gray? Let's show you an example where that occurs by selecting the maternal mortality rate. This map shows only a handful of counties in shades of pink, and you can see the vast majority are gray. What do these gray areas mean? Good question. The gray areas in this map are counties where the CDC needed to suppress the data to protect the privacy of the person or people who died, or marked it as unreliable. It represents the key challenge we face in intersecting maternal mortality data. We found that much of the data on maternal mortality was suppressed or unreliable, especially at the county level. It also illustrates why innovation was and is so important in this area. As part of our initial phase, we employed several innovative strategies to help address these data issues. First, we used a 3-year period for the maternal mortality data. And you can see that when you click on the information icon to see the definition here. Second, we incorporated a measure called maternal deaths that provides information on where any maternal deaths have been reported or not. Third, we also included information on risk factors for poor maternal health outcomes, as well as access to maternity care. You may also see examples where only the county or only the state level can be visualized in the map, depending on the appropriateness of the measure for display at different geographical levels or the current availability of data. So we'll look here at severe maternal morbidity, where you can see that only the state level data can be explored. We plan to explore additional measures and innovative strategies to address these data limitations in phase 2 of our effort. And with that, we'll conclude our live demonstration portion of the webinar today. We hope that you enjoyed this brief journey through the intersection of broadband and maternal health. And I'll turn it back over to Karen.
So Ariel, thank you so much for that. Although we work on this day in and day out, it's sort of new and fresh every time. So thank you. This now is our question and answer portion of our webinar. We do have a couple of questions. I'd like to start with one great question. It is the participant asks, why is the data at a county level as opposed to a city or neighborhood level, right? And that makes a lot of sense to me in terms of why we would choose to aggregate up as opposed to sort of de-aggregate down. And are we masking some differences in broadband and health? And let me explain why we did it. And then obviously we would welcome input, ideas, suggestions, alternate approaches, other views that we might want to build in future phases of the platform. So we focus on counties for a few reasons. First, county level data is available across various health and connectivity benchmarks. So what we want is to ensure we can do apple to apple comparisons. And this is not just a connectivity map, it's not just a health map, right? We need to have this cross-sector approach, and so we need a common geographic unit, right, that we can intersect. Another reason we choose the county level is because they are discrete geographic units that can potentially drive broadband economies and local health policy. If you're too large or too small, it is much more difficult to do that. And finally, counties are really the building blocks in many ways for sort of publishing many types of data, for example, economic data, and for tracking progress and regional population and economic trends. And so there's a natural fit there. So again, we would welcome other ideas about how we might want to slice and dice the data, really unpack it. But thank you so much for this question. It was a great one. Ariel, do you have another question?
Sure. So our second question is, could you speak more to the maternal health and broadband data sets used to create the mapping tool? So the current mapping tool relies on broadband data that comes from the FCC's Form 477 data program. And so that is and it represents data from 2019. The maternal health data comes from various different data sets. It comes from the NCHS, National Center for Health Statistics, data on mortality that is accessed through CDC Wonder, as well as various other data sets from HHS, the Health and Human Services, and HRSA. And if you're looking for more specific details on all of the data in the mapping platform, remember that you can go to that data tab that's in the platform and see of all of the different measures that are visualized in the platform, the course, information on the data years, and the definition. So I invite people to go there and explore the data in more detail. But that gives you a high-level overview. That's a great question.
Great question. I think we have a question where I'm going to actually try to share my screen, right? Live demo means live demo. The question is, could you please explain again what double burden and opportunity mean? And so Ariel, I'm going to ask you to do that. Let me see if I can share my screen and pull up a slide that sort of shows that, but feel free to get started while I do.
Sure. Double burden and opportunity areas represent different county the intersection of broadband and health. In other words, where broadband and health needs coincide. So focusing on double burden areas, these are areas that are experiencing higher health need, so having worse health outcomes or other health measures, as well as lower connectivity. So these are areas that are priorities from both a health and broadband perspective. On the other hand, opportunity counties are areas that are experiencing, again, that higher health burden, but are actually potentially more connected to broadband resources and are experiencing above average connectivity. So you can see here in the graphic that my colleague has put on the screen, how these areas come together, or how health and connectivity come together, categorize counties into these 4 different county categorization. And opportunity counties with higher health need and different connectivity levels, and single burden and milestone counties with lower health need and different connectivity levels.
That was fabulous. Okay, if I can get Zoom to stop sharing this, I hope that answered the question. And again, we greatly appreciate the engagement. So I am curious about, Ariel, is there one other question that we've received that we might want to try to tackle?
Sure, yes, we have one more question here. It asks us, how has the task force worked with CDC and HHS to use this data to improve health outcomes? Throughout the process of implementing the Data Mapping to Save Moms' Lives Act, we have conducted consultations with the CDC and our other sister agency partners to try to better understand the maternal mortality data in the mapping platform, as well as the types of questions and visualizations that would really be relevant to informing their work. And we plan to continue that collaboration and consultation going forward as we look for additional ways to improve the mapping platform.
And they have really been wonderful partners, I will say. We have a question here that says that we cite increased mortality in certain populations, but we don't have filters for all of those. And I think it's a great observation. And you might have been a fly on the wall then as we've been planning phase 2 of this platform, where we do think it's critical to sort of disaggregate a bit sort of the way that the race and ethnicity filters are currently sort of grouped. I would just encourage you to engage with us. We are looking for public input on how to make that race and ethnicity filter more powerful, more useful to users, to better understand the kinds of use cases that users might use such a filter to explore. So thank you so much for the question. Please know that we'd love to hear more about how you might use it. You can contact us at engagec@fcc.gov. So, I think we're nearing the top of the hour, and I'm checking to see if we have a fair number of questions here. We want to just make sure that, I see another question coming to me. The question is, what role do you see for other communication methods like texting in helping to drive healthcare access in comparison to technologies that rely on broadband like telehealth? And the participant notes the fact that there can be real differences in the tech literacy of certain populations, maybe based on income and education and other characteristics. Great question. And Aria, you can speak to this too. I would say in short, the answer is a complementary role. Right? I think we are also trying to make sure that we are future-proofing the way in which connectivity supports maternal health and healthcare. We don't want to exacerbate a digital divide. So today, texting, tomorrow, other cutting edge, AI-enabled and other kind of technologies. And we would hate not to do what we can now, as Michelle said, and inadvertently then play into a world where there are digital haves and have-nots. So great question. Again, we'd encourage you to continue to engage. I don't know if you have other thoughts on that.
No, I thought that was great. Yeah.
All right. So I think at this point, what we want to make sure we do is that we save a bit of time to talk about what our next steps are, and to encourage you to continue to follow the work of the task force. Those were excellent questions. And if we didn't get to your question today, please know that we will respond by email in the coming days using the registration information that you provided. So thank you again for the engagement. So here's the question: where do we go from here? And clearly, Chairwoman Rosenworcel laid out some important steps. We need information, we need ideas, we need input on the kind of use cases that you would like to see a platform like this enable. We are working to further update, expand, and refine the platform. And we would just welcome that input, that feedback. There are no ideas that we would not like to engage with. We do plan to add additional maternal health data to the platform. Ariel, I'm going to let you speak to that a little bit.
Looking for additional maternal health variables that are relevant to the broadband space that would help complete this picture or add to this picture of broadband and maternal health. So very curious to hear what would be important to you and what type of data and how you would like to see that data visualized in the platform. Those types of use cases or examples or questions that you have that you would like a platform like this to be able to answer would be incredibly helpful.
Absolutely. And one thing that I think would be of particular interest is any feedback on that conceptual model that we shared, right? We're thinking about how can we best intersect broadband and maternal health data to create actionable insights for policymakers, for innovators, for entrepreneurs, for clinicians, for researchers, just for others who are interested in this intersection of broadband and maternal health. And given today's webinar and the examples that Ariel walked us through, we hope that you will spend some quality time test driving the platform for yourselves, share the tool with others who may be working in the broadband health space, continue to engage with the task force, both at fcc.gov/health or by reaching out to us, engage C2H@fcc.gov. And we just want to, with that, thank the chairwoman for her just inspiring remarks. Obviously, thank Michelle Ellison, who chairs the task force on which we have the pleasure to work. And thank all of you for joining this afternoon. And that concludes today's webinar.